can be a nightmare, as most buildings have not factored in key installations to enable free movement. Over time, human rights groups have come together to implement an integrated social accountability and advocacy project to ensure the country's policies, plans, and budgets on universal healthcare are equitable and inclusive. One such organization is working intensively with women and girls with disabilities to voice their demands for quality and accessible healthcare locally, while ensuring their perspectives inform county and national dialogues on UHC.
To realize the right to health and ensure the progressive achievement of Sustainable Development Goal 3 and Vision 2030, the Kenya government launched Universal Health Coverage Pilot Phase in December 2018. Ultimately, the success indicator of the UHC in Kenya is whether equity has been achieved. The poorest in the society, the most marginalized and the most vulnerable people enjoy health and well-being risk protection as enunciated in the principle of leaving no one behind.
And some of our facilities, we have specific people allocated that duty, so that whenever we are having people with disabilities coming to our facilities, we should give them the first priority so that they can also feel as if they can have that feeling they are also taken care of, just like the other patients.
But now we want to have a system whereby an officer from the department is the project manager to oversee and make sure that whatever will come out, if it's a building, if it's a project, a toilet, they will also have a facility that is disability friendly.
WRA Kenya, an organization seeking equitable and inclusive plans and budgets on UHC for persons living with disabilities under the project dubbed UHC for Me, is designed to simultaneously improve UHC principles of quality, equity and dignity at the point of service delivery and influence long-term system-wide change for priority populations.
Msichana mwenye naishi na ulemavu na niko mjamzito, na wakati nitakuja kujifungua nina matumaini kwamba nitapokelewa vizuri, kwa sababu wakati wanakuja kliniki napokelewa na pia najua kitanda nitapewa kizuri.
Since the project inception, significant progress has been made from developing community action plans, detailing the prioritized health needs and action demands for those living with disabilities through the convening of sub-county and county advocacy conversations with target decision makers to secure commitments to respond and act, particularly to introduce inclusive customer care service desks and install ramps and disability-friendly toilets in 2 target health facilities.
Wengine wako friendly to them, they harass them, wanawaharas, afu wengine wanawatreat, hata hawawezi kuwatreat kuwapea hiyo service wakati walemavu wanataka matibabu. Alafu when it comes to maternity, wanawake wa kujifungua wanapata vigumu, wanapata wakati mgumu kujifungua, hasa mambo na vitanda ziko friendly to them.
Leila Mohamed, NTV.